next speaker, Dr. Ishita Pandey, please. And she'll be talking to us about first Indian results of Femto LASIK with shrimmed ATOS for myopia and myopic astigmatism.
Good afternoon, everyone. The topic of my study is first Indian results of Femto LASIK with shrimmed ATOS for myopia and myopic astigmatism. There were no financial disclosures. Although several studies worldwide have evaluated Femto LASIK outcomes, limited data exist on the Schwi system specifically. To the best of our knowledge, no research has been conducted on its performance in Indian patients till date. The aim was to find out the visual and refractive outcomes of Femto LASIK with Schwi for myopia and myopic astigmatism in Indian population. Study design was prospective observational study, population being patients who underwent Femto LASIK at our center, and Schwi was used for flap creation, and Schwi MRS 500E examer laser was used for stromal ablation. Inclusion criteria with patients with myopia and myopic astigmatism who underwent Femto LASIK with Schwi and who had at least 3 months of follow-up. These were my pre-op refractive ocular examinations that are done routinely at a center. This is the Schwi machine used for delivering the laser for flap creation. So final post-op refraction at 3-month follow-up, prediction error, efficacy and safety index were calculated. These are my statistical analysis. Results, a total of 100 eyes of 55 patients were taken into consideration. Distribution of myopia severity were 21% mild, 45% moderate and 34% high myopia. The UCVA of 20 by 20 or better was seen in 82% of eyes at 1 week post-op and 86% of eyes at 3-month post-op. Now comparing the pre-op and post-op 3-month visual and refractive outcomes, the UCVA improved from 1.03 to 0.06 logmar, BCVA improved from 0.04 to 0.03 logmar. There was statistical significant difference noted between the pre-op and post-op values, and similar can be seen in the following graph. The efficacy index based on the UCVA and BCVA were 0.98 and safety index was 1.04. Now the refractive stability was noted in the post-op period day 1 month and 3 month. As per the table, the diopter sphere, diopter cylinder and diopter spherical equivalent were in negative sign in post-op 3-month period, signifying that there were no overcorrections. And there was statistical significant difference between the pre-op and post-op values for all these 3 parameters also. Now this is a scatter plot of attempted and achieved spherical equivalent. And as we can see that there's a strong correlation noted as all the points lie along the trend line, and this shows high predictability for outcomes. The spherical equivalent refraction at 3 months within plus minus 0.25 diopter of intended refraction was seen in 83% of eyes, within plus minus 0.5 diopter seen in 95% of eyes, and within plus 1 diopter seen in 100% of eyes. One instance of suction loss during the femtosecond laser application was noted, and the procedure was abandoned. No significant complications were observed during the follow-up period of 3 months. Discussion. This is the first study that highlights the efficacy and safety of Femto LASIK with Schwi femtosecond laser system to correct myopia and myopic astigmatism in Indian population. The quick recovery of UCVA was attributed to the smooth and uniform corneal flap creation by Schwi, which promotes faster healing and reduces post-op discomfort. The results of this study are similar to the findings of the other studies also. The excellent refractive results that we had found were due to key features of the Schwi, that is, its ability to be customized. This attribute has enabled surgeons to modify flap sizes as per the specific requirement of each patient. The precision of Schwi in our study is evident with the spherical equivalent refractions that we had found at 3 months, discussed before. The safety index of more than 1, that is 1.04, signifies that there was gain in BCVA line post-operatively. The advanced features of Schwi noted were low pulse energy, that is high pulse rate of 4 MHz, asymmetric spot spacing, and Centrax eye tracking system. So these features have helped to create smoother flap surface and thus improve the post-op outcomes. They have helped for quicker procedures and faster visual recovery. They've enhanced the efficacy of the procedure and helped in achieving refractive accuracy. As observed in our study, femtosecond lasers, including Schwi, have helped in creating predictable and uniform flaps and has helped minimizing flap-related complications. The limitation of our study were small sample size and short follow-up of 3 months, which does not capture the long-term visual and refractive outcomes and complications. So conclusion, Femto LASIK using Schwi is a safe, effective, accurate and stable option for correcting myopia and myopic astigmatism in Indian patients. The study establishes Schwi as a reliable method for refractive surgery in India with excellent visual outcomes and minimal complications. Thank you.
Good talk. You had any hypermetropes also in your study?
No, ma'am, all were myopic patients.
So you only lay emphasis on this particular machine doing very well with myopic.
Yes, ma'am.
But you have your experience with hypermetropes also?
No, ma'am. So there's a different software that needs to be installed for hypermetropic patients, which I don't think I think it's going on with this machine. It's not yet come in the market for hypermetropia.
Okay.
So I had a question. So you said the efficacy index was slightly lesser than 1, right? 0.98 or so. Normally we consider as 1 as the gold standard for efficacy index, although the amount of correction and the values at 3 months correspond to any other laser system that we have. So any specific reason for that? How come the efficacy index was slightly lesser?
Ma'am, this is a short-term study at 3 months. So if so we took 3 months as our endpoint because this is a new machine. And we need to know the short-term safety and efficacy. If it has gone, like we now know that it is good. Now we will go on with the long-term studies, and maybe then we can find, maybe then the efficacy might increase more than 1. But as of now, it was 0.98.
But you had 100 cases, right? So it looks
100
like
eyes.
100 eyes.
Yes, ma'am.
Yeah. So did you compare any comorbidities or any kind of strata, because you are in Sadhguru?
Yes, ma'am.
So there was the follow-up was 3 months, and
Yes, ma'am.
did you find any difference in your study, and did you take that into account of the
Ma'am, as in between the patients?
the ablation results in any of these with any dry eyes or ocular surface issues?
Ma'am, actually,
You could have included
yes,
that
ma'am.
also in the study.
Ma'am, in our center, actually, dry eye workup is not a routine for refractive patients unless somebody actually shows symptoms. That is when we do it. So here we did not find, at least up till 3 months, we did not find any patient with obvious symptoms. So we did not measure it.
Yeah, but this is a very important point. Most of these patients, they use contact lenses, and there would be some dry eye workup is very important.
Right, ma'am.
Thank you.
Thank you, ma'am.